911 recorded line. What's your emergency?
I stabbed myself. I think I might have punctured a lung. It's been an ongoing depression and it just escalated.
But we're sending some help. We're gonna help you.
I see this as the defining medical problem of our time. It's estimated that about 20 million Americans have a substance use disorder, and in Massachusetts, about 1 in 20 adults has a substance use disorder.
When I was 13, a lot happened. I was having a lot of negative feelings about myself. They were like, yeah, you definitely have bipolar disorder. And I was scared. Fear took over, really. And then I found drugs and alcohol. Didn't make me feel so alone. When I called my dad for detox, I was 21 years old, and I had gotten into some trouble. I was tired of fighting, tired of wanting to die but not dying. And just like seeing like the disappointment on his face was really, truly just shattered my heart.
When I first met Shannon many months ago, and she was really struggling. She was pregnant, about to have her baby, and she had a history of substance use. We worked together. I gave her the evidence. She told me what she needed. I provided what she needed, and she's such a beacon of light.
We're working with Julie Paul to help her add addiction treatment services to her perinatal behavioral health program, and that will take care of women who are pregnant and postpartum for up to 2 years with respect to their addiction and or mental health issues.
I want more people like me. I want more people to say that I made it through, and more people to be on a video that can say I did it.
Behavioral health and substance use is our #1 call for service within the town of Weymouth 911 program.
6 to 8 unwanted.
For the first year of doing Weymouth 911 services, we saw over 2,000 calls for service for behavioral health and substance use combined. This is our neighbors, our families, our friends, people of all areas of the community. We have a bunch of innovative programs that we have in place. The first is an embedded clinician, behavioral health clinician with Weymouth Police and ourselves, and that has had a massive impact in the response to behavioral health substance use patients in the town of Weymouth.
We are developing an inpatient addiction medicine consult service, which will provide addiction medicine services to patients in the hospital. We are also developing an outpatient addiction medicine bridge clinic. This clinic will take care of patients for as long as necessary until we connect them to long-term office-based or primary care-based addiction treatment.
I mean, this has impacted our EMS family here. We've had a paramedic succumb to this. Within our own team. So this is why it's personal for us.
I met Dan when we just graduated high school. Not long after dating, probably a few months, I realized that through everything, he was going to be my best friend in life. And we had a great social life. We went on vacations a lot. We have 2 beautiful children. He had a great career and he loved what he did. He worked long hours, so I think it was when he started getting into pills, it was easy for him to hide.
All of us are at risk, and if not individually, our families are at risk, and our kids and grandchildren and parents and grandparents. So we've integrated behavioral health here, which I think has been really good. Departmentally, we're trying to get all of our providers also educated about Suboxone and have the ability to prescribe it.
We're developing an office-based addiction treatment model so patients can get their primary care and addiction care in the same place at the same time.
I feel like if Dan could have found a good resource closer to home where he was still an integral part of our family and still had a role, then it probably would have worked a little bit better for us. I got a call at 6 a.m. from his father that they had found him. They found him in a bush. So, I don't know.
What's your emergency?
Oh my God, my husband. I think he may be overdosed. Baby, wake up, wake up.
Ma'am, stay with me on the line. Are you certain he's not breathing?
He's dead. He's dead, I just know it.
Okay, ma'am, help is on the way. Help is on the way.